All right, welcome to the Healthy Pregnancy Summit. And again, the focus of this summit is a healthy pregnancy. Today we have Kathy McKain with us from the Midwife Center in Pittsburgh. Kathy, are you there?
Yes, I'm here, Bo.
Good morning, good morning. Thank you so much for taking your time to join us here.
Thank you. It's my pleasure.
Tell us a little about yourself as a midwife, maybe some of your education.
Well, certainly. I'm a nurse midwife, so that means I came to midwifery through my undergraduate degree in nursing. I went to the University of Pittsburgh, and I have a graduate degree in midwifery and women's health from the University of Pennsylvania. Well, my practice is from the Midwife Center in Pittsburgh, which is a freestanding birth center. Freestanding Birth Center is a licensed and accredited healthcare facility. It's a small facility. It is a healthcare facility, but it is based on the home more than the hospital type model. And as a midwife for many years, I've done birth care in home, hospital, and freestanding birth center. And certainly all of them have advantages, and I think we've had some beautiful births in all these settings.
Okay, so the birth center is actually an alternative to the hospital and the home.
Yes, it is.
Okay, beautiful, beautiful. Well, in regards to a healthy pregnancy, from your viewpoint as a midwife, what types of things are important for you?
What a great question, Bo. First of all, I want to know what's most important to the woman and the family that I'm caring for. Because, in pregnancy care, labor and birth care, postpartum care, there is more than one right and good and safe way to do things. And so we try to provide care in the most palatable way that we can. There are some very basic things that are important to me. Having said that, I really like to work with people on the opportunity of pregnancy to be used as developing the healthiest health habits or lifestyle possible. Increasing people's knowledge about nutrition, exercise, stress reduction, very basic things about health that can make a very significant difference in the well-being of the current pregnancy, but ongoing in their life, And when I think of someone's pregnancy, I think first, healthy mother and healthy baby. But not far behind that, I think, the best psychological satisfaction that we can achieve too.
Well, so stress has a part for a healthy pregnancy.
It does. You will see in populations where people are under more stress, you'll see more preterm birth, low birth weight, and other health problems. There's a lot of well-done writing by a woman named Ruth Lubick. Now, Ruth Lubick didn't perhaps start the first freestanding birth center, but she documented the model so beautifully that she became a MacArthur Award recipient, the Genius Grant. And what she wrote about has to do with sound care and simplicity. And the most important feature, according to her description of this model, was the education of the pregnant woman and her family. Because if people have the information and the tools, they will take the best care of themselves, So it grew from there, from the basic information piece. Now, certainly different states have different statutes that, state physically what the birth center must be like, and programmatically what a birth center would be like. But we focus ourselves on 24-hour availability to clients, visits that are long enough that we can provide teaching about whatever aspect of the pregnancy is going on at the time. We have, of course, childbirth classes at the center and breastfeeding classes and newborn care classes and, the rhythm of the place is set up to try to meet the needs of people who are coming to us for their care.
Now, you just mentioned breastfeeding. With all today's technology and the way that we can handle nutrition and stuff, do we still think that breastfeeding is the best way to go, or, with our technology these days, are we catching up with that?
Well, certainly for people who, for some reason, can't breastfeed a baby, they do have very good formulas available. But if you look at information from, the American Academy of Pediatrics, for instance, they still say that breastfeeding is the best way to feed your new baby if you are able.
Right. I've been called many times, I've seen the perfect food for a newborn.
Yes. Isn't that a nice way to say it? Yes.
Yeah. And so, but also pumping the breast milk if they can't get the baby to breastfeed, that's a very viable alternative, right?
That's right. And, of course, we have a lactation consultant on staff to help us for people who have special needs around that. For instance, if a baby was born preterm and couldn't nurse yet, or if a baby had a problem like a cleft palate, or, or if simply there was difficulty with the latch and the mother was having pain. I mean, there's a whole range of care and intervention as needed.
Yeah, recently, recently a good friend of mine, daughter had a baby, and the baby was tongue-tied, and he couldn't get the latch. Had that the tongue was like tied down, and they had to snip it. They wanted to wait a little on that. Yeah, that's right. That's an example of
it's a small thing, but it can make a very big difference in getting breastfeeding going in a comfortable and satisfying way.
Right. Well, let me ask you this, Kathy. Why would someone want to use your services as a midwife versus an OBGYN doctor?
Well, we consider ourselves all part of the same health team, and there's a continuum of care. Some people are more comfortable with a physician. Some people have health problems or concerns that really require the expertise of a physician. We certified nurse midwives are experts in normal birth, in taking excellent care of people who are basically in good health, and anticipating, a single baby, head down, labor at term. That basic idea is where our area of expertise is. And people like certain aspects of our care, such as that we stay with people when they're in labor and provide physical comfort for them, that we believe in body integrity. There's no, routine use of episiotomy or other things that might be more uncomfortable for a person in the early days after a birth. But we are not in any adversarial way with our physician colleagues. We're just on a continuum with them.
Excellent. Let's see, what else might be important to you? What are things you did mention nutrition, so that's excellent.
Yes.
What about exercise?
Well, I work with people every day with making a plan for adequate and safe exercise in pregnancy, or, we do well woman care too, so also for people who maybe aren't pregnant at that time. Pardon me one second. Right here. Yeah, thank you. I'm sorry, Bo, I'm back.
All right.
So, the recommendations from the American Heart Association have changed over time, but, currently they're recommending at least a half hour a day, every day, for people to exercise. And, we certainly find that for pregnancy, it helps with people's energy. For birth, which is more of an endurance sport, it helps with their endurance. And ongoing in people's lives, well, there's stress reduction, less heart disease. There's a whole myriad of things that are helped by exercise, not the least of which is, people who exercise well have a lower incidence of gestational diabetes and type 2 diabetes, and those are two illnesses that are on the rise in our country. So there's some very basic good that can be done, and sometimes people aren't sure where to start or how to start, so we try to individualize the care, make recommendations if people have access to, anything from yoga classes to Zumba classes to a swimming pool to just walking. I mean, walking is wonderful exercise.
Right. Let me ask you this, Kathy, if I may, regarding if someone was at let's say the center with you and, about to deliver, and there was some kind of problem that popped up, then would maybe that would require a C-section or something. Would you do that there, or would you transfer them from the center?
We would transfer from our center to our hospital, which is about 2 miles away, where we also have admitting privileges. Yeah.
Okay.
Yeah.
And do you do anything for pain management that's outside of the norm, or is a midwifery birth like you wouldn't use something like an epidural?
Well, if people want to have epidural anesthesia, we care for them in hospital. We don't do epidural anesthesia outside of the hospital. But here in the center, our model is set up for birth that doesn't have an epidural. So we have whirlpool bathtubs for people to labor in. We do, walking about. We feed people who are in labor, massage them. We do hands-on care that is meant to be, assuage the discomforts of the labor. But if that is not adequate, or if someone knows from the beginning that that's not what they want, then we plan their birth in a hospital so they can have epidural anesthesia. Here in the birth center, we can administer analgesics, but we don't do anesthesia.
All right, excellent. So in the birthing that might happen at the center there, if the baby's father is able to participate, do you have any kind of a coaching program to work with him, and do you mainly work with the mom?
Well, we ask the couple to go to the classes together, and we have a lot of respect for the role that the partners have in the birth. We are very, very inclusive, very supportive of the partner.
And what type of classes would those be that are at the center there?
Preparation for childbirth classes, we use somewhat of an eclectic approach. It's not, Bradley or Lamaze or hypnobirthing, but it has components of those kinds of classes and some very specific information about, making the most of using an out-of-hospital site.
I would like to ask you, if there was just a couple of things, say maybe 3 main points that you could leave our mothers to be with. What would be a few of the most important things for them to look at in their pregnancy?
Okay. Well, first of all, the care of themselves, good exercise, good nutrition, adequate dental care, all the things that can help keep that woman healthy. Stress reduction being a big part of their general health. And when choosing a healthcare provider and a site to give birth, that they just take the time to educate themselves and find someone that they find palatable to care for them. One of the issues that you might hear a lot about now, for instance, is the rising cesarean rate. So it's 33% nationally, but for us in our birth center, it's depending on the year, 12 to 15% of women will have a cesarean birth. Well, that means they have to leave the center, of course, and we take them to hospital for that. But if things like that are important for them, that they do some research into what's available in their community and find their most palatable and, provider who fits their philosophy and their needs the best. And then I guess the last thing I'd say is, in some ways, when you think about midwife and birth center, you think about pregnancy. But I really think that the postpartum period, the time after the baby's born, is one of the most challenging times to women. And I like women to try to really make sure they have good support set up for themselves and that they have the ear of their provider for anything that they need during that very important time.
Wow. Excellent, Kathy. I want to thank you so much for taking some time today. Hopefully there'll be another time we'll be able to pick that up.
Okay. I would love that. Thank you, Bo.
Kathy, thank you very much. And there'll be some information up on the website regarding Kathy and her center. If people wanted to look up some more information about that, that'll be made available. Again, Kathy McKain from the Midwife Center in Pittsburgh. Thank you very much, and we'll see you with our next topic.
Great. Thank you and good day.